In this video, I'm going to go over the 8 red flag signs for low back pain. If you or a loved one have any one of these, you need immediate medical attention. My name is Dr. Nick from Preferred Physical Therapy, where we help people 40 plus stay active and independent, live free from painkillers, and avoid surgery. And we get this question often in terms of when do I need to go to the ER or when do I need medical attention for my low back pain. We've even had some patients who had some of these red flags and did not realize it, didn't tell us about it, or their condition had changed, and it was important that we were aware of what to do next so they could get the right course of treatment for their low back pain. Low back pain can be incredibly debilitating and scary, terrifying. And in this video, I want to help you understand when is it appropriate for you to seek medical attention. These red flag signs are an indication that something more serious is going on and you need something specific to get it taken care of. The reality is 90% of low back pain does not need any medical attention, does not need anything crazy. 90% is going to get better either on its own or with conservative treatment, such as exercises, physical therapy, chiropractic care, massage, stretches, all the other things that we've been talking about. There is a group of about 10% of all low back pain cases that require additional medical attention. The first red flag sign for you to be aware of is if over time, your low back pain is getting worse and incrementally worse. Right? Day after day, it's getting worse and getting worse and getting worse. It's time to go in and see a doctor. The second red flag is if you're having pain down your leg, but not just pain, you're having numbness, tingling, and weakness in that leg, or now as you step down that leg, it's giving out, or you're noticing your foot isn't clearing the rug or the threshold of your doorway, it's getting caught on things, you're having a hard time pulling your foot up, or as you walk, you're hearing your foot slap on the ground as you walk. These are red flags indicating that we have a pinched nerve in our back that's now not able to send motor signal or muscle signal down into the leg, and that's a concern. The third red flag for low back pain is any loss of bowel or bladder control. Even if you're losing sensation of feeling the urge to go to the bathroom, that's a red flag, and go to the ER immediately. Another red flag is if you're having low back pain with a fever or infection. This is a concern because what that often means is we don't know what's going on in your low back that could be causing that. And it could be an abscess, it could be any number of things going on that will need some medical attention. If you've had back pain trigger with a fever, go into the ER and have it checked out. Another red flag is if you're having low back pain with a history of cancer. Now, this is not something that I urge you to go seek medical attention right away, but often it is a concern if you have a history of recent cancer, this new episode of low back pain that you've never had before, it's one to go talk to your oncologist or primary care doctor about that might need additional imaging to confirm that it is something either of a mechanical low back pain nature or something that needs more aggressive treatment. Another red flag is trauma or injury, meaning any kind of fall or car accident, even a near fall. You don't have to actually have a fall to the ground, but a near fall or some kind of a jarring event that can then create some kind of back pain. Then it goes back to our first red flag. If you're getting, after that trauma or injury, you're getting this worsening pain day after day after day, then it's time to go seek professional help from a healthcare provider. The last red flag sign is if you're noticing unexplained weight loss and low back pain that kind of come on around the same time, go seek professional help in regards to what might be going on. These can be underlying conditions of cancer or infection. So keep an eye on that. A lot of folks maybe don't know the time frame at which they might be losing weight. If you're not doing anything intentional to lose weight and you're losing weight, and then you start having back pain, that's where we say that's unexplained weight loss. Is you're not doing anything on purpose to lose weight. You're eating normally, you're exercising or not exercising normally, you're doing your normal things, but you're losing weight. That's called unexplained weight loss. And if that's happening and you're having new episodes of low back pain, talk to a healthcare professional. If you're experiencing any of these red flag symptoms for your low back pain, I do recommend that you seek medical attention. Some more urgently than others. Just remember, 90% of all low back pain is treated conservatively. Only 10% require advanced medical treatment. So now you know what are some red flags concerning back pain. Kind of keep it in your back pocket, keep them an idea where if you're talking to friends or family or begin to experience these things yourself, you know when is it appropriate to talk to your doctor about and when is it appropriate to seek urgent medical care. If you're not experiencing any of these red flag signs and you're having episodic low back pain that seems to come and go every couple of years, it lasts for a couple of days, then lingers for a couple of weeks, I put together an at-home program for you to do on your own very easily. It's a series of exercises designed to help you eliminate your low back pain. Take a look in the description below for the link for more information.